what can you do for arthritis? So a lot of people that we see here in the clinic get really frustrated when they're told they have arthritis. They think that there's really nothing you can do, that you just have to live with it or wait until it becomes so significant that then they're looking at surgery. So there are lots of things we can do for arthritis, especially if you find it early enough. If you find out that you have arthritis or even just pain in your hip early enough, what we can do is strengthen any of the weak muscles that are around the joint of the hip. The stronger you have a support system around that joint, the less pain overall you will have, because there'll be less pressure going into that joint just from the bones themselves. So you give the bones and joint a support system. What else can we do? We can help you stretch, learn how to stretch, and teach you the tools that you need in order to be able to handle it on your own as well when you're done in therapy. When you come in therapy, if you're lacking some range of motion and you have tight muscles, we'll teach you the stretches you need to know in order to stretch them out more, as well as do some hands-on stuff. A lot of times the muscles around the joint get guarded and very tight. Sometimes spasms happen, so we can help alleviate all of that if you come in for therapy. The biggest thing is, as soon as you have discomfort, you want to handle it. It's a lot easier to handle it when it's very mild. As it progresses and you do nothing about it, that joint just gets worse and worse and worse, and then you'll end up finding out that you're bone on bone, and at that point there's no real hope as far as trying to prevent surgery, and you would have to have a hip replacement.